Thank you, everybody. Is presented by Dr. Mary Lou Hulseman, an MD and a MAPS doctor out of Indiana. Today's topic is ADHD causes and treatments, a holistic approach. Thank you very much, Dr. Hulseman. Perhaps what we can do to get started is share a little bit about yourself and your practice, and we can jump right into your presentation. Thank you.
Yeah, sure. Yes, as you mentioned, I'm a board-certified family practitioner. I've been in practice for over 30 years, but became interested in integrative medicine about 20 years ago in order to help our daughter, who was diagnosed with an autism spectrum disorder, had a lot of behavioral problems. Later on, realized that she actually was suffering from pandas, but we didn't even know that because it hadn't even really been described until a couple years before that time. So I started treating her, and she got better and better, and then now that's all I do is integrative medicine with kids with autism and related disorders, which to me includes ADHD, PANS and PANDAS, bad OCD, bad anxiety, that sort of thing. And I do this by looking at holistic situation, what's going on with the person. That is, what's going on with their diet, what's going on with their lifestyle, what sort of nutrients do they need to drive their biochemistry for a particular reason, and what environmentally might be taxing them. And I'll talk about that a little bit more. So my main goals of this meeting, one is to introduce myself, which I just did. The second is to talk to you about ADHD and holistic approach to ADHD, with really an emphasis on environment. Introduce you to Medical Academy of Pediatric Special Needs, of which I'm a fellow. So fellow just meaning I've had advanced training with that group because I've been doing it so long. But MAPS is a group of people who trains other practitioners into integrative care for kids with autism and other pediatric special needs such as ADHD, bad OCD, bad anxiety, Down syndrome. And that's the website where you can go if you're interested in finding a practitioner. If you're interested in my practice, that's great because I'm open for business. I just started my own practice a few months ago. But if you don't think we're a good match, but you're interested in this, you can go to MAPS. If you're interested in parent information, the tacanow.org website is what I recommend because that's vetted by my colleagues at MAPS. So let's talk about definitions of ADHD. Now, I hate it when people read slides, but I have to apologize because I'm going to read the next couple of slides because it's not my words, it's somebody else's words. But I think it's helpful to really get our head around what people mean when they talk about ADHD. So the National Institute of Mental Health says that attention deficit hyperactivity disorder is a developmental disorder marked by persistent symptoms of inattention or hyperactivity and impulsivity that interfere with functioning or development. Those symptoms begin in childhood, can affect daily life, and include social relationships and work or school performance. And it's well known among teenagers and kids, but can travel into adulthood as well. In fact, many adults have difficulty. So anyway, going back to the CDC definition, ADHD is one of the most common neurodevelopmental disorders. And then they go on to tell us that neurodevelopment means it has to do with the way the brain grows and develops, which as an aside, I don't think that's necessarily always true. But it usually is first diagnosed in childhood and then lasts into adulthood. And people with ADHD have trouble paying attention, controlling impulsive behavior. They may act out without thinking, and they may be overly active. So the Diagnostic and Statistical Manual is a manual put together by psychiatrists to carefully define certain disorders. And you can use that link if you want to look at the diagnostic criteria for ADHD. And I'll talk about them in just a minute here. But it's important to understand that it's a really common problem, that 5 to 12% of school-aged children have some degree of ADHD. That's way, way more common than when I was a kid. So something's going on in our environment, in our world to make this more common. And we can talk about that more in the question and answer period if you guys are interested. But in order to fit the DSM-5 criteria, a kid has to have 6 or more symptoms persisting more than 6 months and have to interfere with function. So they divide the symptoms into attention and hyperactivity, impulsivity. In terms of attention, the child has to fail to pay close attention to details, make careless mistakes, have trouble holding attention and focusing on whatever's going around them. They may seem not to listen when spoken to. They don't follow through on instructions. They have trouble staying on task, organizing tasks or activities. They avoid or are reluctant to do tasks that require prolonged mental effort. They lose things necessary for their tasks. They're easily distracted. They're forgetful in daily activities. They have trouble with executive functioning or thinking through things in detail. It may sound familiar to many of you for your children. The hyperactivity impulsivity symptoms include fidgeting, tapping hands or feet, squirming in their seat, restlessness when they're trying to pay attention. They might leave their seat and not be able to stay in their seat when it's expected to do so. They might run around and climb on things in situations where it's not appropriate. They're unable to play or take part in leisure activities because of this hyperactivity. They're on the go as if they're driven by a motor, trouble sitting still, staying still, talking excessively, often loudly, blurting out an answer, have trouble taking turns, they interrupt or intrude on others, they're excited, reactive, impulsive, have tantrums, have increased involuntary movements. And many of us will see a lot of these symptoms, right? And so, again, in order to fit the diagnostic criteria for ADHD, according to the psychiatrist, a kid has to have 6 or more symptoms lasting 6 months. Okay, that's great. So why do you want a diagnosis? Well, the psychiatrists like the diagnosis in order to decide, is it time to start medications? But what if a kid has 3 symptoms that are very impactful for only 4 months? So they just ignore it for 6 months? Well, I guess by their criteria you do. I find that inadequate. I think if a child is having any difficulties with any of these symptoms, we ought to be, and they're impacting them in terms of their learning and ability to function well, then we should be trying to figure out what is the root cause and fix that if we can. So what do I think about diagnoses? I don't really care, actually. I'm more trying to figure out the symptoms and the cause and how they fit together. So I want to know, is it mainly hyperactivity, mainly poor focus, overfocus, or is it information processing? So sometimes we'll tell a child something and they'll act like they're not paying attention, but it takes them 3 or 4 beats to get the information and then to process it and get it back out again. And we need to give them time if that could be going on. I also want to know, what are the associated symptoms? And could the child be hyper in order to pay attention? So if a child has low energy for a variety of reasons that we'll talk about, sometimes they're moving around because they want to stay engaged with what's going on around them. So let's talk about my overall approach to this, which again should be the overall approach of most integrative physicians, which is to supply what's healthy and needed, remove what's causing harm. And often what's causing harm are things like environmental toxins, be that in the food, in the water, and the air, in their body itself. And the patient is the best lab. Meaning when I'm trying to treat patients, usually I will try to do one thing at a time and assess whether that thing is good or bad. Typically, if someone has enough difficulties with focus or hyperactivity, it's not one cause, and it may take us a little while to figure out all of the different causes and address all of them. But if a test tells us, for example, that they need X, and we give them X and there's no benefit, then we're not going to continue X. Or if the test might say, well, they probably don't really need this particular thing, but the history suggests it, and we give that particular thing and the child does better, then we hang on to it for a while. Okay, so let's talk about causes of poor focus or inattention. Stress and anxiety. If somebody is in a difficult situation for whatever reason, of course they have trouble focusing. We are all aware of that. Allergies, straight up allergic rhinitis can cause a kid to have poor trouble focusing. And so if there are associated symptoms with allergies, giving a trial of an antihistamine can be really beneficial. Pain, such as abdominal pain or headache, can make it hard to pay attention. Hypothyroidism or adrenal fatigue, you need a physician to probably help you figure out if that's going on with your child. Various nutritional deficiencies can lead to poor focus. Need for certain nutrients can lead to a focus. So there's issues of deficiencies and we replace the deficiencies, but sometimes we need to give higher doses of nutrients in order to drive biochemistry in a particular way. Then toxins in the body, whether they're toxic metals, chemicals, or mold toxins, can also interfere with the ability to focus. Mitochondrial problems do as well. And so the mitochondria are like the batteries of the cell. And if that battery has been damaged, isn't working properly, then that cell doesn't work properly. So if the mitochondria in the brain aren't working well, a person has trouble focusing. And we know that mitochondria are often damaged by environmental toxins. Seizures are rare, but can be a cause of inattention, especially for folks with autism, but it can occur in a typical kid as well. And they may kind of stare off into space, and in fact, they're having a seizure. That is abnormal electrical activity in the brain that's interfering with the brain function. So let's talk about causes of hyperactivity. Poor sleep, especially sleep apnea, or restless legs that can be caused by iron deficiency or allergies. Sleep is very complex. There's lots of different components of sleep, and you have to have good sleep to be able to focus well. Constipation is a cause of hyperactivity. If somebody's uncomfortable because their bowels are backed up, but if they have intestinal infections such as yeast overgrowth or parasites, that can also be a cause of hyperactivity. Diet issues definitely can cause hyperactivity, especially too much sugar, particularly on an empty stomach, but dyes can be a problem as well, or chemicals. Phenols are natural chemicals in foods that can cause our kids to be hyperactive. They're in foods such as strawberries and tomatoes and bananas or apples. And so the way you know that's a problem for your child is if your child is craving those foods and then they're super hyperactive afterwards, you may want to decrease those foods in order to help them be less hyper. Histamines can come because their allergies are too high, or because there's mold in the environment, or parasites or something else which is driving histamine. Excessive use of screens, I think, is a very big problem, especially with Wi-Fi. And so our kids may be looking at the screen for a long time, and they may or may not readily give up the screen, but they can be very hyper afterwards. And maybe that has to do with addiction to the screen, or maybe it has to do with some. And so wiring things in and downloading things and putting on an airplane mode may really help a child who's hyper with screens, and also limit the use of the screens, of course. Lack of enough exercise. That's a huge problem in our society, I think. People need to be physically active every day. I think adults 30 minutes to an hour and kids a couple of hours a day. And most of our kids don't get even close to that amount. They might get 30 minutes in school. Lots and lots of exercise can make a huge difference in decreasing hyperactivity. Sensory issues and other discomfort can be an issue. So kids who feel like the clothes are uncomfortable on their skin, the tags are bothering them, that can be a problem. And again, back to mitochondrial problems. And this is a little counterintuitive because you would think that if you don't have energy of the cell, then you'd be lower energy, and that can be true. But also, as I mentioned earlier, kids who are low energy sometimes will want to be hyper in order to stay engaged, and that can occur because of mitochondrial problems. So, how do we begin figuring this out? The most important thing by far is a detailed history for each patient. I have a questionnaire that I have patients filled out each time they come in, but the first one is particularly helpful to get a history of what may be the reason for this child to have their problems. So, my history starts with pregnancy and delivery, and I'm looking at maternal stress and mom's medical history, as well as things that happen in the pregnancy and delivery itself. For the child's history, I'm very interested in if there's been some infection, excessive use of antibiotics, if there's been a known toxic exposure, such as exposure to mold or lead, and also whether the kids had gut problems, even if they don't have them now. Like a baby with reflux or history of constipation or diarrhea may have some things going on in their gut that interferes with their focus, and that's helpful history to have. I also want to know, how did their development go? How did they do with their motor skills? Did they crawl properly? Did they roll properly? Did they sit up on time? Were they starting to speak on time? And I want to know what's going on in the current home environment. I'm interested in, do they have wall-to-wall carpets? Wall-to-wall carpets are terribly toxic, especially when they're new. They outgas a lot of chemicals that are a big problem for us, our health. They really should be there. But when they're old, then they can collect dust, which can be a problem if kids has allergies. It can also be a problem because if it gets wet, then you can have mold growth. Pets, I love pets. I think our kids should have pets, but they really shouldn't be in our kids' bedrooms because they can get allergic to their pets' fur and dander and then have trouble with focus. Also, I want to know about the electronic use. I really want electronics to be completely out of the room and the Wi-Fi to be off at night. And I want to know about chemicals in the home. There's obviously a lot that sometimes needs to be done in a person's home environment, things that people may not even know about immediately, and it may take some time, but it can make a big difference in the child's health and therefore ability to focus. Also want to know a lot about sleep, and I want a lot of detail. I want to know, do they have trouble falling asleep? Do their legs move around as they're falling asleep? Do they pause in their breathing in the middle of the night? Do they sleep in funny positions, especially a kid who tips its head way back like that? That can be a sign of sleep apnea. Do they have nightmares, which can tell me about what nutrients they might need, or also what stress they might have had? I want to know about the diet, and I want to especially ask the parents, what have they noticed as a problem with their child? Because many parents coming in have already figured out that diet is a problem and too much sugar is a problem. I also want to know what's a typical breakfast. So we know with ADHD that if you miss breakfast, you have a hard time focusing. But if you have a breakfast that's heavy in carbs, you also have a hard time focusing. So a breakfast for a child, really for anyone, ought to have quite a bit of protein in order to keep blood sugar stable, in order to be able to focus. I also want to know, how does the kid do at meal times? Are they able to sit still? Do they have snacks at bedtime? That can be good or bad. Are they a picky eater? Therefore, do they have some sensory problems that are interfering? I also want to know about their activity level in a lot of detail, and I want to know how much screen time they have versus outside time that they have. This is, of course, a big, big challenge in our current lifestyle, because a lot of parents are using screens quite a bit. There's reasons why we have our kids use screens. They can be a very educational, it can also be a helpful babysitter, but the balance needs to be right. Laboratory testing can be useful. It's not the most important thing. The history is by far the most important thing, but sometimes labs can be useful. And so I'll often do blood work looking for some nutritional deficiencies, knowing that a lot of nutritional deficiencies are actually very hard to detect on blood work. But we can check iron, we can check vitamin D and zinc. We'll also want to look for thyroid testing as well. I'll also do other testing kind of based on history. So sometimes I'll have a sleep study ordered. Sometimes I'll have an electroencephalogram looking for seizures ordered. An x-ray looking for constipation can be useful. And a specialty test like a urine organic acid test could be useful as well. Again, depending on the history and what we think is going on with the child. And then after we've addressed all of those things, if the kid still has problems, then we'll go deeper. That is, we'll look to, could there be mold toxins that we didn't suspect based on history? Could they have a toxic metal overload? A lot is misunderstood about toxic metals. So when you're checking your child for lead and you do it in the bloodstream, it only tells you, was the child exposed within the last 3 months. It doesn't tell you if mom had been exposed to lead or if grandmother had been exposed to lead. And it's interesting that about 50% of us born in the 20th century were exposed to toxic amounts of lead because it was in gasoline and in paint until the 70s. And we know that if a woman, a grandmother, had high levels of lead as a child, she's much more likely to have a grandchild with ADHD. And it's because the lead is intergenerational. It goes from one person's bones to another person's bones. So the exposure doesn't have to be in the child's lifetime to still be relevant. And the reason why they might have a toxic load might have to do with their genetics and their genetic inability to get rid of the lead compared to another child who doesn't have these problems. So how do we treat? We supply what's healthy and needed. We remove what's causing harm. Sounds simple. Sometimes it is, but often it takes quite a while to figure out all the different issues. And again, the patient is the best lab. So the history and the testing are what I base a treatment on. Again, focusing on history more than anything. Start with the basics. So it's always important to have a good diet and good breakfast in the morning. Super important, really important to get rid of the chemicals from the diet, really have the diet be organic in order so that there aren't pesticides in there, get rid of genetically modified foods because foods are generally genetically modified in order to spray Roundup, which is a terrible toxin, should not be in our environment or in our bodies. So those are the kinds of things you want to do for diet. Treat nutritional deficiencies, and I usually will start with a high-quality multivitamin, and whether the kid's diagnosed with autism or not, I'm assuming it's the same set of problems going on. That is, some genetics and some environmental exposures, mostly environmental exposures, leading to nutritional deficiencies that, again, can be hard to test for. So doing a really high-quality multivitamin, such as Spectrum Needs from NeuroNeeds or Energy Needs, is useful, but there are a lot of other really good ones out there that I will use and recommend. I do recommend that if you are starting a multivitamin, that you get a high quality one. Don't bother with an over-the-counter Flintstones or something. First of all, it could have something that's actually bad for your child in there, but also there's nothing there that's really helping replace nutritional deficiencies. They're really only to keep somebody from becoming deficient, and usually you're not going to see anything clinically beneficial. Whereas often when I start a good quality multivitamin, the kid who can't focus, they have a better time focusing. Not always, but often. Then we'll add additional vitamins depending upon the deficiencies we find and the symptoms. So if the zinc is low, we'll add zinc. If the kid's very impulsive, even after they've been on a multivitamin a couple weeks, I'll add additional B6, for example. We'll also provide methylation support in the form of methylcobalamin or methyl B12, methylfolate, or sometimes trimethylglycine or trimethyl or dimethylglycine, which can help with focus. We'll use healthy fats, omega-3 fatty acids, and phospholipids, with the idea that the brain needs those healthy fats in order to communicate and work better. Also, of course, to treat the adrenal and thyroid problems that we might have detected either on testing or physical exam. Epsom salts are really helpful, and anybody can do this. It's magnesium sulfate. The magnesium sulfate is good for eliminating toxins from the body, and it's particularly helpful if you have a child who is sensitive to those foods that I've talked about before that are high in phenols. We also figure out the cause of the sleep problems as best we can and treat them. If the child only has a problem falling asleep, often the trick is just to give them a low amount of melatonin. 0.5 to 1 milligram is a good place to start. But you could go up in a child as high as 5 and 10 milligrams safely. Usually that's much higher than necessary, and we don't want to give too much because the child may wake up with a headache and being grouchy because it's too much medication or too much melatonin. Melatonin is a natural hormone, it's not a medication. We treat constipation. And sometimes that's just a matter of switching up the diet. The number one cause of constipation is dairy allergy or dairy sensitivity. So sometimes just removing dairy, getting more fruits and vegetables in the diet are great. Many people also need to be gluten-free, but not necessarily everybody if the problem is just ADHD. If it's autism, I do recommend removing gluten as well, because it's not just about the focus, it's about other things that might be limited. But then you also, make sure they're drinking lots of water and lots of fiber in the diet. And then consider additional helpful supplements, and we can talk about that in a minute. And then medications are the last resort in my view, or I sometimes will use medications as a bridge. So for example, if I have someone who has poor focus, who've identified they have lead in their body, it's going to take us some months to maybe a year or two to get that out of their system. And we know that they're getting a little better as we're treating the lead, then it can be useful to use the medications. If somebody comes into my practice on medications for ADHD, I typically don't stop them if they're helping and there aren't significant side effects, but my goal is to lower them and get the child off of them. There is some concerning data in the animal world if we start these medications too early that we may be actually setting up a person for poor focus and poor mood later, in that those medications can interfere with the development of the dopamine centers in the brain. So those are the main reasons why I don't like to use medications. And also it's not solving anything, it's just covering up a symptom. Okay, so additional treatments you could add for inattention might include, and I would do this by working with a practitioner, they might include lithium, DMG, pycnogenol, fatty acids, zinc, green tea. And having said that, actually, it's more the zinc and the lithium dosing that I would work with a practitioner. The other things you could try on your own, again, if it's good quality. Supplements that can help with hyperactivity might include more magnesium. You have too much magnesium if the kid has diarrhea, so really pushing up the dose can be very, very helpful. Theanine can be calming. Sulforaphane helps with brain inflammation and can help with calming as well as inattention. Taurine, GABA, resveratrol can all be helpful for hyperactivity. And I wouldn't throw the book at your kid and give everything at once. I would do one thing at a time. There are some supplements that are have several of these together, and that's okay as long as you're doing one supplement, one thing at a time, so you can really assess, well, is it helping your child? It's nice to know if you're spending your money correctly. It's also nice to know if there's a problem, what's causing the problem. So some kids, though, for really complete brain healing and resolution of their symptoms, they might need additional things, such as longer-term detoxification for heavy metals or mold, hyperbaric oxygen therapy, sometimes different types of immunotherapy for allergies. We do a type of immunotherapy under the tongue every 2 months that is actually helpful for foods as well as inhalants and is super safe. There are some caveats, but it's a great treatment actually, and can be very helpful for focus. But they also might need treatment for some of those developmental problems that they did not move through. They might have some retained primitive reflexes that need to be eliminated. And sometimes neurofeedback is helpful. And there may be some other things appropriate to your child. But as I said, that I start stepwise because I find there are some kids where they just switch up their diet and get on a fish oil and a good quality multivitamin and their ADHD goes away. They continue those things for several months to a few years and then withdraw and they're fine. That doesn't always happen, but it does. So it's worth, if you're listening to this, you have a kid like that, go ahead and try those things. And then if you're up against a wall, then come see someone who could help you. So we'll take some questions here in a few minutes, but again, that's my information. I'm in Fishers, Indiana, which is just north of Indianapolis. As I said, I just opened my own private practice about 5 months ago. Prior to that, I worked with a large hospital group. And so I have access now because I have my new practice. If you're interested, again, if you're not interested in me, but you're interested in this concept, please visit medmaps.org. You can find a clinician near you there. So I'm ready to take questions anytime you're ready, Chris, if anyone has anything.
Well, thank you, Dr. Hulseman. We don't have any questions in the chat, but that was a very comprehensive and holistic approach to ADHD. I have a question in regard to with the treatments that you propose and the approach that you take is really I'm totally impressed with it. Can you give us some indication as to how fast you start to see results when you start using some of your treatment regimens?
Yeah, that's a great question. It depends on the intervention, it depends on the degree of efficiency. So, for example, when we start out with a diet change, sometimes within a week or two, a kid is much better. Sometimes it's a month or two if they're sensitive to gluten, for example. Usually, if it's something like dye or sugar, it's pretty immediately within a week. With the multivitamin, again, depends on how deficient the person is, but often that is pretty quick as well. Within even a couple of weeks, the kid's focus is better. Same thing if we figure out that they have allergies and we treat their allergies, it can be very fast. If we've identified a food that's interfering with sleep, again, it can be pretty fast. So other things may take longer. If they have sleep apnea and we have to go through the road of figuring out, doing a sleep study, finding out they have sleep apnea, when I diagnose a kid with sleep apnea, I will first try things like diet changes, especially removing dairy and sugar, and treating any allergies, and maybe using some nasal sprays like Xlear nasal spray that can help open up the sinuses and treat what might be going on infection wise. And if that still doesn't work, then we'll send them on to an ear, nose, and throat doctor to see would it be appropriate to remove the adenoids as a cause of the sleep apnea. If that's the case and they need their adenoids removed, then usually about a month later, their focus is much, much better as their sleep has gotten a whole lot better. Other things take a lot longer. So if somebody has a toxic metal load, that might take a year or so to completely improve, but usually there is gradual improvement in their focus over that year or two of working with the person. So it really kind of depends a little bit on the intervention and how impaired that person is by various different things.
Okay. And then the other question that I had was typically parents get started with their practitioner with a pharmaceutical for
Mhm.
ADHD.
Yeah.
And then over time, they look for a more holistic approach. That occurs frequently.
Yes.
What are the ramifications of starting with a pharmaceutical, or what are the long-term ramifications of being on a pharmaceutical?
Yeah.
And then, do you find like weaning them off of that pharmaceutical can be challenging?
Yeah, good questions. Yes, so the long-term ramifications, if you look at a child with ADHD who gets medications versus not, the long-term outcome in terms of academics is exactly the same. So we're not really helping them academically by doing ADHD medications. The long-term problem with ADHD medications, I worry, but we haven't proven, is if we start it too soon, does it actually change the function of the brain so the person has trouble focusing later on? I mean, I think that's a huge worry that
Yeah.
animal studies indicate that, so it probably is happening with people as well. I do find it challenging to get the kids off of the medications if they come to me and they've been on them for a while, especially on pretty high doses. Most of the time, I can be successful at decreasing the dose. It can often be very hard to eliminate the dose until they've gone through development in teenage years and young adulthood and adapted in other ways, which I think is kind of a shame because I worry about them long term. What is that going to do in terms of mood? But that's generally what I find. So yeah, I really prefer that if somebody's struggling with focus, that they come in before starting medications, and that we detect what are the issues that they need to deal with those issues as well as we can, and then if we need medication as a bridge, going ahead and doing that. So, for example, that's actually what happened. Our son had problems with inattentive ADHD, and he fell behind academically in first and second grade. Really, kind of struggled a lot, poor kid. And we put him on Concerta, one of the stimulant medicines, for a while. And he caught up and he was doing really well, although he still had some challenges in organization and other things, but his mood was terrible. He was just such a bear when the medicine came off, and I just didn't like what I saw, and so we stopped it. And it didn't at that time actually make much difference. We continued to treat him for lead overload and a few other things, and his ADHD eventually went away. So, but was a very helpful bridge to help him catch up when he really needed to. So that would be an example of where I will use a medication personally.
Okay. And you also mentioned histamine. I
Yes.
believe you mentioned histamine, and I think that's an under uh, diagnosed area whereby a lot of these kids may have don't have maybe the enzymes to provide like food histamines for that matter. And can you elaborate a little bit more on histamines and how they impact the child?
Yeah, I can try. I'm definitely not a histamine expert, but what we do know is there are histamines in foods. Histamines are also produced by the mast cells, who are activated when the mast cells come in contact with toxin, such as mold or other chemicals. They can be activated in the context of stress as well. And if the histamine gets high, a symptom of that, or a sign of that rather, is if you take and scratch your arm just a little bit like this, if it becomes red pretty quickly, that means the person is high in histamine. And it can be helpful then to take an antihistamine sometimes. There are different enzymes like DAO that can be helpful, and one can try to figure out what's the cause of the high histamine. Sometimes the cause is, oddly enough, a parasite that's just very difficult to diagnose, and so some parasitic treatment can be helpful. But I find that a lot of people have high histamine when they have mold toxins in their system as well. So that's, I guess, the answer to the question.
Yeah, excellent, excellent. Does anyone have any? If anyone has any further questions, you can put them in the chat. Outside of that, Dr. Hulseman is available at info@allboardim.com, and she's out of Fishers, Indiana. Dr. Hulseman, thank you very much for today's presentation. This presentation will be recorded and sent out, and will be available on the NeuroNeeds YouTube page. Thank you again, Dr. Hulseman.
Thank you. Thank you all.
Bye-bye now.
As always, consult your physician before trying any of our products. For more information, visit neuroneeds.com. We would appreciate it if you would like, share, and subscribe. Thanks for being part of our journey.